Hey, Dr. Ratcliffe here. I'm sitting around during the COVID crisis and got nothing to do, so thought I'd do a really cool functional medicine overview with a case, and we're going to call this case Jemma. Jemma's case is gonna take us in a number of different places. She's got cancer. There's autoimmune disease. There is infection, and we're going to do some lab work review. Hopefully, we'll get to all that today. It might need to be a part 2, 3, and 4. But here we go with Jemma. All right. Jemma is a 47-year-old female. She has a history of breast cancer having reoccurred a second time. First time she was in her mid-30s, and most recent relapse was about 4 years ago. She is BRCA positive. Not sure if it's 1 or 2, though. After giving birth to her second son, she developed joint pain. It was also difficult for her to lose weight. And during the workup, it was discovered she had a high ANA. And ANA is an autoimmune marker called an anti-nuclear antigen. It's more of a systemic kind of autoimmunity versus an organ-specific autoimmunity. So an organ-specific autoimmunity would be things like MS. You have a predictive antibody to myelin-based protein, and your body starts attacking the white matter. Another one would be things like type 1 diabetes. That would be to the insulin-producing part of the pancreas, and we have predictive antibodies for that specific to that organ. And ANA is kind of a more of a widespread autoimmunity affecting most cells, so the nuclear material. So it's a little different. So she has a on the workup, it was discovered she had a positive ANA. Ultimately, though, she was diagnosed with Hashimoto's. So she also has a organ-specific autoimmune disease. By the way, Hashimoto's thyroiditis is the #1 autoimmune disease in America. It affects about, out of every low thyroid patients diagnosed, 80% of those are Hashimoto's disease. So the predictive antibodies for that are TPO and thyroglobulin. Okay, interesting enough, with her Hashimoto's, her initial lab work showed elevated thyroid hormone, and then subsequently it was running low and then high, and sometimes we do see that in a real active phase. When there's gland destruction, you can sometimes spill over and you have symptoms of hyperthyroidism and then bounce back to hypothyroidism. So she had Hashimoto's. All right, so we're going to occasionally, how I'm going to do this talk, we're going to have a pearl that we throw in throughout the case. So pearl number 1. Sometimes we see triggers in autoimmunity after giving birth. And that's because there's an upsurge in a hormone called prolactin during labor and delivery, and once nursing starts, it helps the mother produce breast milk. But anyway, an increase in prolactin can sometimes be a trigger for autoimmune disease. So on the other hand, what's interesting is some people do great with pregnancy, especially my rheumatic disease patients. And that has to do with some changes in the immune system, some interesting changes in the immune system that dampen and quiet down some of the Th1 types of diseases, especially rheumatoid arthritis. So we do see that. But when these same people start nursing again, sometimes they'll get a flare. So this was Jemma's case. So she was doing fine, she was doing great, and then she had a baby and started nursing, and then had difficulty losing weight, severe fatigue, joint pain. She was never diagnosed with rheumatoid. She didn't fit the criteria, but Hashimoto's was the ultimate diagnosis. Okay, that was our first functional medicine pearl. An upsurge in prolactin from nursing can sometimes cause a upsurge in autoimmunity, can sometimes trigger it. You know what? Functional medicine pearl number 2. A positive ANA, and it stands for anti-nuclear antigen. A similar type of test called an agglutination reaction is also a rheumatoid factor in CCP. It's how we diagnose rheumatoid arthritis. These people who have these types of autoimmune disease can very often be flamed up and more sensitive to lectins in their diet. So lectins contain a substance called PHG, phytohemagglutinin, And common lectin foods there's two types of foods. There's the nightshade family of foods, which would be tomatoes, potatoes, eggplants, peppers, and then the bean family, which would be legumes, especially kidney beans. So kidney beans can oftentimes flare you up. So if you're one of these people who does have an ANA related disease, by the way, an ANA related disease would be things like classically would be lupus. It would be scleroderma, it would be Sjogren's syndrome, mixed connective tissue disease, maybe Behçet's. There's a couple of them out there that are related to having a high ANA. So if you have those, you may want to go on a low lectin diet and see if that can, maybe calm down some of the inflammatory changes. When you have an autoimmune disease or you're inflamed, you want to do everything you can to bring down the other sources of inflammation. Inflammation can stimulate and turn on the genetic response for autoimmune disease, and vice versa. Autoimmune disease can drive inflammatory changes. So if you're reacting to certain foods in your diet, like lectins, you want to quiet that down so you have less of a inflammatory and ultimately autoimmune response. Getting back to the case. Jemma, first bout of cancer, she had chemotherapy and did fine with it. She was considered in remission. After many, many years, 10 years, she discovered another lump in the breast, and this time, instead of having chemotherapy, radiation was performed. She had a very rare complication called radiation pneumonitis and pericarditis. Multiple trips to the emergency room with chest pain. This is not a common condition at all. Not at all. As a matter of fact, her medical oncologist and radiation oncologist certainly knew about it, but they'd never seen a case of this disorder. Maybe we'll circle around to that, because I think this is going to lead into some lab findings. So I'm just going to throw this out there. When you have a patient with kind of the hollow space dysfunction, like she did with the pneumonitis, these types of patients with hollow space dysfunctions, think of the hollow spaces in the body. So you have your sinuses, you've got your lungs, you've got your GI tract, you've got your bladder lined with epithelial cells, right? Sometimes if there's some dysfunction in those spaces, you'll have an elevation of what's called a Th2 polarization, which can cause a number of things. Likewise, if you have certain other diseases, like diseases of atopy, allergies, asthma, eczema, hives, and she did have hives, and she had some reasonable allergies, you can also have a Th2, a chronic Th2 polarization. So we're wondering if kind of her proclivity to being Th2 polarized, which we'll do another video about that. That's a long discussion about immunology, but may have made her more likely to develop this pneumonitis that she had. And interesting enough, we did a case study on her. The only thing that helped this, and this should help other people. We should have tried to publish it, but the only thing that helped her condition was bromelain. The treatment for radiation pneumonitis is high doses of anti-inflammatories, but she couldn't tolerate those, so we had to try some other things. Bromelain was the thing that ultimately worked after about 8 months. So if you can't tolerate that, or if you know of anybody that has that, have them try bromelain, and it was a pretty high dose though. You don't want to take both bromelain and NSAIDs, because you thin the blood too much. Okay, getting back to the case. So she has, maybe we'll talk about the hollow space dysfunction a little bit later on. So her current situation is this. For 1 month, she has not been feeling well. Let me try to move me out of the way here. For 1 month, she hasn't been feeling well. She's been losing weight. She has GERD, reflux disease, abdominal pain, loss of appetite, and very tired. She has a difficult time keeping her eyes open past 8 p.m. Recently, she is back vacationing from a tropical Central American country, Costa Rica. It was during the latter part of the stay that she developed abdominal pain and discomfort, and it has continued now for about a month. Okay, that's the case. What I'm going to do now, we're approaching the 10-minute mark. I'm going to make another video that'll be a part 2, and we'll call this one Jemma part 2. Okay.